What if I told you that something as simple as sexual self-care could be the difference between thriving in your golden years or struggling with depression, physical decline, and cognitive fog? Today, we're breaking one of society's biggest taboos. We're talking about something that affects millions of older adults worldwide, yet nobody wants to discuss it. The hidden crisis of sexual abstinence and aging, and how it's silently destroying both bodies and minds. Stay with me for the next 25 minutes, because what you're about to learn could revolutionize how you think about healthy aging. This isn't just about pleasure. It's about survival, vitality, and maintaining your quality of life as you age. But first, let me ask you this. When was the last time your doctor asked about your sexual health? Probably never. And that's exactly the problem we're solving today. Welcome back to Elderly Wisdom of F1U, where we tackle the health topics others won't. And today we're diving deep into a subject that impacts millions but remains shrouded in shame and silence. Sexual health doesn't expire at 65, 70, or 80. Yet our society treats sexuality in older adults like it's somehow inappropriate or irrelevant. This cultural blindness is causing real harm, physical, mental, and emotional damage that we're only beginning to understand. Over the next 25 minutes, we'll explore the shocking physical consequences of sexual abstinence in older adults, the mental health crisis nobody's talking about, how hormonal changes amplify these effects, the cardiovascular risks your doctor might be missing, practical solutions that can transform your health, and why this conversation could save your life. So let's break the silence and dive into science. Let's start with some uncomfortable truths. According to research from the National Institute on Aging, sexual activity drops dramatically after age 65. But here's what's shocking. This isn't just about decreased libido or physical limitations. For many older adults, sexual activity, including masturbation, stops completely. The statistics are staggering. Over 40% of men over 70 report no sexual activity in the past year. Nearly 60% of women over 70 report the same. Among those in their 80s, these numbers climb to over 70%. But here's the kicker. Research shows that sexual activity, including masturbation, plays a crucial role in maintaining physical and mental health throughout our lives. When we stop, our bodies and minds begin to suffer in ways most people never realize. Dr. Patricia Bloom from Johns Hopkins has spent decades studying sexuality in aging populations. Her research reveals that sexual abstinence in older adults creates a cascade of health problems that doctors rarely connect to sexual health. Think about it this way. We know that use it or lose it applies to muscles, cognitive function, and even social skills. Why would we think sexual function is any different? The truth is, when older adults stop engaging in sexual activity, whether with partners or through masturbation, they're not just losing pleasure. They're losing a vital component of health maintenance that affects everything from their immune system to their will to live. Now, let's get into the nitty-gritty of what actually happens to your body when sexual activity stops in older age. Prepare yourself. Some of these effects might surprise you. Cardiovascular health decline. First, let's talk about your heart. Sexual activity, including masturbation, is a form of exercise. It increases heart rate, improves circulation, and releases beneficial hormones. When this stops, especially in older adults who may already have limited physical activity, cardiovascular health can decline rapidly. Studies show that men who maintain regular sexual activity into their 70s and 80s have significantly lower rates of heart disease. The mechanism is fascinating. Sexual arousal and orgasm release nitric oxide, which dilates blood vessels and improves circulation throughout the body. Without this regular cardiovascular stimulation, older adults may experience decreased circulation to extremities, higher blood pressure, increased risk of blood clots, reduced heart muscle strength, hormonal disruption. Here's where things get really interesting. Sexual activity triggers the release of crucial hormones that older adults desperately need. When sexual activity stops, hormone production can plummet even further than the natural age-related decline. For men, regular ejaculation helps maintain testosterone levels. Without it, testosterone can drop to dangerously low levels, leading to severe muscle mass loss, bone density decrease, cognitive fog, severe depression, complete loss of energy. For women, sexual arousal and orgasm release estrogen and other beneficial hormones. The absence of sexual activity can accelerate vaginal atrophy, severe dry skin, bone loss, mood disorders, sleep disruption, immune system suppression. Perhaps most shocking is the effect on immune function. Sexual activity boosts immunoglobulin a crucial antibody that helps fight infections. Research shows that people who engage in regular sexual activity have 30% higher levels of this antibody. For older adults whose immune systems are already compromised, this difference can be life or death. Without regular sexual activity, they become more susceptible to respiratory infections, urinary tract infections, slower wound healing, increased cancer risk, pelvic floor deterioration. The pelvic floor muscles support crucial organs and control bladder and bowel function. Sexual activity, particularly orgasm, provides essential exercise for these muscles. Without it, older adults experience severe incontinence, pelvic organ prolapse, chronic pain, reduced mobility, sleep and pain management. Sexual activity releases endorphins and promotes deep sleep through hormonal changes. Without this natural pain relief and sleep aid, older adults often struggle with chronic insomnia, increased pain sensitivity, dependence on sleep medications, reduced quality of life. If the physical effects weren't alarming enough, the mental health consequences of sexual abstinence in older adults are equally devastating. We're talking about a hidden epidemic of depression, anxiety, and cognitive decline that's directly linked to the absence of sexual activity. Depression and isolation. Sexual activity releases a powerful cocktail of mood-regulating chemicals: dopamine, serotonin, oxytocin, and endorphins. These aren't just feel-good chemicals. They're essential for mental health maintenance. When older adults stop engaging in sexual activity, they lose access to this natural antidepressant system. The results are predictable and tragic. Clinical depression rates skyrocket. Social withdrawal increases. Feelings of worthlessness intensify. Suicidal ideation becomes more common. Dr. Sarah Mitchell's groundbreaking study followed 1,200 adults over age 70 for 5 years. Those who maintained some form of sexual activity had depression rates 40% lower than those who didn't. Even more striking, the sexually active group showed better social connectivity and life satisfaction. Cognitive decline acceleration. Here's something that will blow your mind. Sexual activity is brain exercise. The neurological pathways involved in sexual response overlap significantly with those responsible for memory, problem solving, and executive function. When sexual activity stops, these neural pathways begin to atrophy. Research from the University of California found that older adults who maintained sexual activity showed better memory retention, improved problem-solving abilities, slower progression of dementia symptoms, better overall brain health. The mechanism involves increased blood flow to the brain during sexual arousal, which delivers essential nutrients and oxygen to brain cells. Without this regular stimulation, cognitive decline accelerates. Anxiety and fear. Sexual abstinence in older adults often creates a vicious cycle of anxiety. As sexual function declines from lack of use, anxiety about sexual performance increases. This anxiety then further suppresses sexual desire, creating a downward spiral. This isn't just about sex. It's about fundamental self-worth and identity. Many older adults begin to see themselves as sexless beings, which profoundly impact their self-concept and mental health. Loss of purpose and vitality. Perhaps most heartbreaking is the existential impact. Sexual desire and expression are fundamental aspects of human vitality. When older adults lose this connection to their sexuality, they often report feeling like they're just waiting to die. This isn't dramatic language. It's a documented phenomenon. Gerontologists call it sexual bereavement, and it's a real contributor to the high rates of depression and suicide among older adults. The shame spiral. Our society's ageist attitudes toward sexuality create additional mental health burdens. Older adults who do have sexual desires often feel ashamed or abnormal. This shame prevents them from seeking help or finding healthy outlets for their sexuality. The result is a perfect storm: biological needs suppressed by social shame, leading to isolation, depression, and rapid health decline. The effects of sexual abstinence aren't experienced equally between men and women as they age. Understanding these differences is crucial for addressing the problem effectively. Women's unique challenges. For women, the situation is particularly complex. Postmenopausal women face a double challenge: declining estrogen levels and societal attitudes that essentially declare older women as sexually irrelevant. Without regular sexual activity or masturbation, women experience severe vaginal atrophy that makes future sexual activity painful or impossible, complete loss of natural lubrication, shrinking of vaginal tissues, increased risk of vaginal infections, loss of sexual desire that may never return. The use it or lose it principle is especially cruel for women. Once vaginal atrophy sets in, reversing becomes extremely difficult. Even with medical intervention, men's hidden struggles. Men face their own unique challenges. The pressure to maintain erectile function often leads to complete sexual withdrawal when problems arise. Without regular sexual activity, erectile dysfunction becomes permanent. Penis size actually decreases due to tissue changes. Testosterone levels plummet. Prostate health deteriorates. Risk of prostate cancer may increase. Research suggests that regular ejaculation may help prevent prostate cancer. Men who maintain sexual activity into their 70s and 80s show significantly lower prostate cancer rates. The widowhood effect. Loss of a spouse creates particular challenges. Many older adults essentially retire from sexuality after losing their partner, not realizing that masturbation can maintain their sexual health and overall well-being. This decision, while emotionally understandable, often leads to rapid physical and mental health decline. Studies show that recently widowed individuals who maintain some form of sexual activity adjust better to their loss and maintain better health outcomes. Now, for the good news, it's never too late to reverse many of these effects. The human body's capacity for recovery, even in advanced age, is remarkable. Here are evidence-based solutions that can transform health outcomes for older adults. Medical interventions. First, let's address the medical options. Modern medicine offers numerous solutions for age-related sexual challenges. Hormone replacement therapy can restore libido and function. Medications like sildenafil work well for older adults. Vaginal moisturizers and estrogen creams can reverse atrophy. Testosterone therapy can restore energy and sexual desire. The key is finding healthcare providers who take sexual health seriously in older adults. Don't accept you're too old for this as an answer. The power of solo practice. Masturbation offers all the health benefits of partnered sex without the complications. For older adults, it can be the perfect solution for maintaining sexual health. Regular masturbation maintains hormonal balance, preserves sexual function, provides cardiovascular exercise, supports mental health, requires no partner. Mindset shifts. Perhaps most importantly, we need to change how we think about sexuality and aging. Sexual desire and expression are normal, healthy parts of life that don't expire at retirement age. Creating supportive environments. Adult children and caregivers need education about the importance of sexual health for older adults. Privacy and dignity around sexuality should be respected in all care settings. Technology and resources. Modern technology offers discrete solutions for older adults wanting to maintain sexual health, from educational resources to devices designed for older adults. Technology can bridge the gap between need and fulfillment. What we've discussed today isn't just about sex. It's about recognizing the full humanity of older adults. When we deny or ignore the sexual needs of aging individuals, we're essentially saying they're no longer fully human. This attitude is killing people. Not metaphorically, but literally. The cascade of physical and mental health problems we've discussed contributes to premature death and unnecessary suffering. The solution requires a cultural shift. We need to normalize discussions about sexuality and aging, train healthcare providers to address sexual health, develop age-appropriate resources and solutions, Support research into sexuality and aging. Challenge ageist attitudes about sexuality. Every older adult deserves to live with vitality, dignity, and a full range of human experiences, including sexuality. If you're an older adult struggling with these issues, know that you're not alone and help is available. Start by talking to your doctor, and if they're not receptive, find one who is. If you have older parents or loved ones, consider how you can support their right to privacy, dignity, and yes, sexuality. Share this video with someone who needs to hear this message. The silence around this topic is literally killing people, and your share could save a life. Subscribe to this channel if you want more content that tackles the health topics others won't address. Hit that notification bell so you don't miss our upcoming videos on related topics. And remember, aging doesn't mean the end of vitality, passion, or joy. Don't let anyone tell you otherwise. Thanks for watching, and I'll see you in the next video.